This 14-year-old just won America's Top Young Scientist for creating a bar of soap that prevents skin cancer, specifically melanoma. And the crazy thing is that this bar of soap will only cost you 50 cents per bar. His name is Heman Bekela, and he explains in his presentation that in the United States, there's a 98% recovery rate to melanoma, but the average patient pays $40,000 in medical bills. But in other third world countries, the recovery rate is only 20%. Due to lack of availability to treatment and expense, people are forced to live with melanoma. Heman figured out that dendritic cells promote your skin safety, but when they come in contact with melanoma or HPV, they weaken. So he invented a bar of soap that reactivates and promotes the growth of dendritic cells. With his low-cost invention, he hopes to help people around the world fight melanoma and do it for cheap. As always, let me know what you think about all of this down below.
Young Scientist calls it skin cancer treating soap, or SCTS for short. The soap replenishes the skin with dendritic cells, which helps protect the skin and fight cancer. He said that after getting a prescription, the soap can be applied to the skin every couple of days, and then one will start to see progress. Ninth grader was given 25,000 grand prize and is matched with a mentor to help follow through and make adaptations of this soap, make it better. It's most clever because you don't have to add any new application mode. Everyone already knows how to wash their hands and wash their body with a bar of soap. So if you get it in the hands of the big population, you could really prevent a lot of skin cancer, or at least improve the skin condition. Skin cancer is very treatable, but those treatments can cost like $40,000. If you have soap to prevent, especially in areas that have a lot of sun exposure, we're talking about long-term differences with continued use of this soap to create those dendritic cells. And it's beautiful because it's prevention, not prescriptions. And it's cheap and affordable, not...
I found out that I had melanoma at 21 years old. I'm going to share a photo of what the melanoma looked like because I think it's really crazy that it just looks like a freckle. I was really, really fortunate that it was found so early and I was able to remove it. But my GP actually looked at it and told me that it was nothing to worry about. But I ended up going to get it looked at by my local skin cancer center anyway to get it checked out, which was very, very lucky. I actually asked my local skin cancer center for a photo of the actual melanoma because I was getting my check earlier this week. So here it is, the melanoma. As you can see, it's really, really dark. And when you looked at my skin, it was really quite black. Getting melanoma so young taught me that you just can't be ignorant when it comes to the sun. It's so dangerous. I encourage everyone to go get checked regularly and always use sunscreen. I had the melanoma removed, but it ended up getting super infected and now I have this big horrible scar on my back.
So I also wanted to share my story with melanoma. So I had a melanoma diagnosed when I was 31. I was a fellow in Oregon studying plastic surgery. And so I'm a fair, born and raised Southern California person. And I have never tanned. I've never been in a tanning bed. And I can't tan even if I wanted to tan. So I did have a few severe sunburns as a kid, and so that's probably what led to my melanoma. When I was in Oregon, I noticed that a mole on my leg had changed a little bit, and I was seeing a dermatologist when I was up there because I had acne, and I asked several times over a 6-month period, hey, this doesn't look right, can you look at it? And several residents and a couple attendings actually looked at it, even with their little dermoscope, assured me that melanomas rarely come from moles you've had from childhood and tried to convince me that this mole was okay, and I just wasn't comfortable with that. So one day after clinic, I asked my chairman, Dr. Julie Hansen, to biopsy it, and it was in fact early melanoma that was 0.65 depth. So I was very lucky that I was in Oregon because Dr. John Vetto is at OHSU, and he is a very famous melanoma surgeon, surgical oncologist. So I had a wide local excision as well as a sentinel node biopsy. And I didn't quite meet criteria for the sentinel node, but in medicine we often overtreat ourselves. And I was lucky enough to have my co-fellow, Dr. Orna Fisher, close my incision so it looks beautiful. I think it's really important that when you don't feel something is right, even when a doctor tells you it's okay, you can continue to advocate yourself. And although I have resources as a physician that you may not have, you can always ask for a second opinion. And I think it's important that you just relay your concern to the doctor. So although they tell you it's okay, if it's not okay with you, I think it's such a benign thing to biopsy a lesion like that on your skin. I'm a big fan of doing that. I had an attending when I was at Cedars call things bucket lesions, that sometimes it just deserves to be in a bucket and not on you. And if it's causing that much concern, then I think a biopsy is a pretty easy thing to do in the skin. So that's my melanoma story. I'm many years now free and clear. I go in every 6 months for follow-up, and I have labs drawn, and I have a skin exam. And luckily, I haven't had any additional worrisome lesions. But it's really important, again, if you've had childhood sunburns or you've grown up in a sunny environment where you got a lot of sun exposure, you need to have a good dermatologist who listens to your concerns and does a good, thorough skin cancer evaluation, usually about
that occurred when I hit it. It was like, I even kind of made fun of him. I was like, oh, come on, that didn't hurt that bad. It's just this little tiny bump. And he was like, no, like it really hurt. And from what I've read, that is a symptom, like when you hit it or something, that it's really painful. Number 3 red flag was that after, every 6 weeks, month after month, it was still there. So it wasn't going away. So that is another red flag. And then, we just thought it was a wart. After the first month, we thought it was a wart. And he was like, I have an appointment with the doctor in December. In December, I'll have him look at it. Until then, I'm not real worried about it. And, why would you? I wish to God that I would have seen a video like the one I posted previously, because my husband would still be alive today. And that is why I'm putting these videos out. So fast forward to like December, it started looking like it started changing. It started looking different. It kind of like, I guess I would say, like if you took a kidney bean and kind of smashed it, that's kind of what it looked like. So it was getting bigger. It was just a little bit raised, and it had some color to it. Then it was like a dark purple and some dark blue in there. But he had an appointment with the doctor that month. So, he went in for regular routine blood work and, regular appointment. And unfortunately, he was a diesel mechanic, and he had smashed his head, I guess, on a piece of heavy equipment. And so the doctor was like, well, I don't want to biopsy it if we don't know the exact color of it. Come back in a week. Well, that week was then between Christmas and New Year's. And of course, things don't get done that week. And he did not make the appointment when he walked out. And then within a few days, he said, I have like this lump in my throat. And so I felt it. I'm like, well, that's your lymph node, which makes sense because you've had this. Okay, that's another red flag, the lymph node. And then I said, you had like a little bit of a cough. And just like when we were in the gym lifting one day, like he were like almost like a little bit of an asthma attack. Like, he just got winded very easy, and then he couldn't catch his breath. These are all red flags. But I said, you probably have an upper respiratory infection. And I even remember him trying to kiss me once, and I was like, don't kiss me because I don't want to get sick. So the nurse then called me, and she was like, hey, I've got the results of his blood work back. Everything looks great, except for his white blood cells are really elevated. Was he sick? That's another red flag. And I said, no, he wasn't sick, but he's actually sick now. I think he has an upper respiratory infection. I told her what was going on. She's like, yeah, okay. She goes, I'm going to call him some scripts. You can go pick those up for him. And then on his way home from work today, have him stop and get a steroid shot. So we did all of that, 10 days worth of medication. 3 or 4 days after that, he was like, this doesn't really work. I'm going to call the doctor again. And he's like, my lymph node's actually getting a little bigger, and the antibiotic didn't work. So our PCP ordered a CAT scan of the lymph node, and then gave him another round of antibiotics and steroids just to make sure. And then from that point forward, it was just hurry up and make an appointment and wait. So we did the CAT scan, and then we saw an ENT doctor, and then he did a needle biopsy of the lymph node, and then we had to wait for that. And then he presented presented all of his findings to a board of doctors, and then the main doctor in that board took on my husband. In the meantime, a PET scan was scheduled, and then the appointment with that specialist was scheduled, and that all happened in the same day. So we walked into that specialist office at 1:00 in the afternoon, and he came in and he took his mask off, and he said, please take your masks off. And we took our masks off, and he gave us the news. You have stage 4 cancer. It is, it has gone from your lymph node into both of your lungs, your liver, a couple of bones, and some of the soft tissue. And that's that's it. 4 or 5 days later, that was like on a Thursday, Tuesday, that same surgeon scheduled outpatient surgery with him. They removed the mark on his head, and then he actually had a mole on his face that my husband said didn't change, but the doctor's like, no, it doesn't look right, I'm going to take it off anyway. So he went ahead and took that mole off. Then my husband had a full beard, same color as the mole. So, you know, everyone's asking me questions like, how deep was the, you know, the cyst or whatever you call them, you know, like the lesion, like how deep was it, how big was it, you know, what was the exact diagnosis. So that happened on a Tuesday. Friday, we went to see the oncologist, and from that point forward, my husband's like, I'm only dealing with this oncologist. He, for whatever reason, didn't really care for the surgeon. The surgeon did absolutely nothing wrong. I think my husband just had a lot of emotions and kind of took it out on that surgeon. He's like, I'm not going back to him. I don't need to, there's no reason for me to take off work. There's no reason for me to go see him, just for him to give me a report. He can give the report to the oncologist. They're all within the same hospital system, and she can figure it out and deal with it. So unfortunately, I don't know those answers that everybody's asking me, because we didn't go back to the surgeon and get that information. The oncologist definitely had it. And then she recommended immunotherapy. And then I can do another video from that place forward. But those were all of the warning signs and red flags that we missed. And I hope that if you're experiencing some of these, or at some point in your life, you take this seriously.